Changing your Medicare supplement is something you can do each and every day of the year. You don't have to wait till the fall enrollment period to do this. So basically, here's the main reason people consider this and move forward with it. It's really just finding a lower rate for the exact same coverage they have or similar coverage. You may remember when you were learning about Medicare for the first time that Medicare supplements are the exact same coverage from company to company. If a company wants to sell Plan G, for example, they have to sell a product that is exactly to the specifications that the government lays out. So quite literally, company A to company B, it's the exact same coverage. It's the exact same thing. It's like a commodity, like corn or oil or pork bellies. It's funny, this is a picture that my granddad had in his office. He was an options trader, so interesting tie in there. So here's how to do it. How to change your supplement plan. You're wasting time if you don't do this part first, and that is figure out if you're healthy enough to qualify. When you first enrolled in Medicare, you had an open enrollment period where you didn't have to answer health questions to buy the thing. Once you're out of that period, with very few exceptions, you've got to answer those health questions to buy another supplement. Or if you never bought one, to buy one in the first place. If you missed that window, you got to answer these health questions. Most people, if you're generally healthy, you're not going to have an issue. But there are some conditions that are pure knockouts, unfortunately. There are some that are, what ifs, where, basically the insurance companies they now have the privilege to accept or not accept you. That's how they manage their risk. And if they just left it wide open all the time, rates would be through the roof, because everyone would, as soon as they realized they had a big claim coming up, they'd hop to another company to find a rate or hop in. That's just not how insurance works. So anyway, I'm not going to go through all of them. I've got everything listed on the page. You can take a look at that. But if it looks like you don't have any of those conditions, or you have an idea that, yeah, I'm generally healthy enough to give this a go, then we can look at, all right, what are the rates, what are the plans, what are the companies I should be looking at? It's kind of the fun part, if any part of this is fun. I hate to, try to use that term for this. But anyway, the first consideration within that step is we're not at the company or the rate yet. We're at which plan do you want? Plan F, Plan G, Plan N. You may look at the high deductible plans, some of you, but that's not what I'm going to focus on here. Most people in the early 2020s, they're on Plan G. All right, some people are moving to Plan N, but Plan F it's been shut off to new enrollees. So the rates they're already super high. They've been going up for years, and it's just going to get worse. So it's not really cost effective anymore. If you currently have Plan F, you can go buy another Plan F, but I don't recommend it. Here's the reason why. If you move to Plan G, the only difference between G and F is on G, you got to pay the Medicare Part B deductible, which is like a couple $100 a year, and it goes up like 5% a year. So if you are going to save more than that couple $100, which you will by moving from F to G, you come out ahead, and it's just straight math. There's no emotion to tie into this. It's black or white. Plan N, if you want to save a little bit more on the rate, you're going to give up a few more benefits than G. So same general idea as F to G. Plan N, you're going to have co-pays of up to $20 for a doctor's office visit, up to $50 for an emergency room visit where you're not admitted to the hospital. And Plan N also doesn't cover Part B excess charges, which is a super rare thing, usually with like dermatologists, where they don't accept the Medicare pre-approved rate for whatever service, and they can charge an extra 15% on top of that, which you'd be responsible for. It happens in, I think it's like less than 2% of cases. If you're comfortable with that, then Plan N, something to think about. You're going to save even more money. All right, so now we're at the point where, all right, do I want F, G, or N? Your choice is your choice. Now let's go to the market. Let's see which companies are competitive. So obviously we're looking for the lowest rate. It's kind of a no-brainer, but there's a caveat I would put on that. What is this company? Have they been in this business a long time? Or are they just hopping in to see if they can make a quick buck? And they never do. They always just get their rear end handed to them. Is the company financially sound? Is it a blue chip name? If it's not one you've heard of, is it one that's got a good reputation? We want the rate. That's obviously the first consideration, but we want to make sure it's with a decent company who doesn't have a history of massive rate increases or erratic rate increases. Because you may qualify to switch now, but what if, a couple years down the road, this may be your last shot to switch. So if you're, buy it as if it's going to be the very last one that you buy, and you're just gonna have to ride with whatever rate increases come. They will come, but you want to go with a company that's going to have steady ones, not big spikes. All right, the application process, fairly simple. They don't sell these things direct to consumers because they're just too complicated. It would be a mess. So they sell them either directly via agents within the insurance company's call center or something, or they use brokers like me out in the open market to process applications with clients, with policyholders. The application process takes maybe 30 minutes if we're hustling. Most of it is answering the health questions that I alluded to earlier. The rest is just like, what's your name, your address, where do you want the policy mailed, how do you want to pay? That's pretty much it. Underwriting. Some companies have automated underwriting nowadays, and you'll get an instant decision in some cases. Usually if you're like in super good health, you'll probably know whether you were accepted, which you probably will be, right there on the phone when we do the application. If the company doesn't have automated underwriting quite yet, or there's something they want to take a look at, they'll have an actual human take a look. It usually takes a couple business days for them to look through it. They may call you to confirm a few questions that we did on the application. They may call your doctor, but that's pretty much it. So you'll get your decision, am I approved or not? Once you're approved, if you are approved, then you are good to cancel your current plan, but at no time beforehand. You want the promise from the new insurance company, yeah, we'll cover you starting on this date. And I usually recommend let's start it on the 1st of the next month, not on some random day. That way just administrative mess just ensues if you don't choose the 1st. So choose the 1st, and then you call your old insurance company, say, hey, it's been real, but I've moved on. I want my last day of coverage. I'm canceling my policy. I want my last day of coverage to be, the 31st or the 30th of the month. You want it through that day before your new plan starts. So that's the process. A little bit lengthy there, but that's about as quick as I can make it. So if you want my help to do this process for you, to manage it, it makes it much easier, much more reliable. You're not going to waste your time applying for something you don't qualify for. So you can request a quote on the page here. I'll be in touch with you. We'll figure out what you qualify for, what's worth looking at, and then shop the market, apply for it if we find something you qualify for, and secure your savings. So question that is probably in your head related to money, couple questions. The first is, how do I get paid? What's in this for me? My services don't cost you anything. In fact, I'm not allowed to charge for my services. If you buy a policy through me, I get paid a small commission that you're probably paying that you are paying on your current plan. It's the same arrangement that is out there in the market. If you went straight to the insurance company to buy this thing, they'd just take the money they'd pay me and just chalk it up against their marketing or advertising dollars. So you pay the same price going through me, and you get my help for free as a benefit. All right, another question, probably, what can I expect to save here? This is a lot of work. It's a lot of hassle. I don't want to give up a sure thing that I have, which I understand. But here's the thing. As long as you qualify and your application is approved, you are going to have seamless coverage. So there's that. As far as savings go, it really depends on the person. But, if it's $10 a month, that's $120 extra a year. And not only are you saving that money on the front end, you could be moving to a company that's a little more stable as far as their rates go. So that's another thing to consider. And also the plan. If you're in Plan F, that rate's going to go up and up and up and up and up. Maybe time to move into a plan that's going to have a steadier bit of experience on the insurance company side, and so they're not as inclined to jack the rates up. So 20%, 25%, that's a common result. As little as 10% is still worth it. All right, so hopefully that was helpful. If you would like my help to change your Medicare supplement, you can click the link and I'll be in touch as soon as possible. Thanks.